Got a pain in your back that you can't get rid of? Well, there's a minimally invasive way to treat back and neck pain. Here to tell us more is Dr. Michael Hennessy with Renova Spine Care and one of his patients, Misty Rose. Good morning to both of you.
Thank you.
Okay, Misty, I'm going to start with you. I understand that you actually hurt your back Thanksgiving Day. So tell us a little bit more about what happened and how it affected your life.
Sure. I had actually had lower back pain for about a year prior to this past Thanksgiving. And we had company coming, was sweeping the floor, squatted down to sweep it up into the dustpan and couldn't stand back up. So had to have help getting up, and then from there and the next day after on that Friday started the leg pain and difficulty walking.
Wow. Now, Dr. Hennessy, when she came in, you evaluated her and her condition. Tell us what you saw with her spine and what you felt or thought was creating all this pain and causing her to even limp it sometimes.
Yeah, so what Misty had was a fairly common condition actually that can happen to all of us as we, it's always say, get a little more experienced in years. Basically though, and it can actually happen to anyone, of really any adult, but the disc begins to degenerate, and over time, if you imagine the disc is sort of like almost like a donut, like a jelly donut, the softer center, as the disc degenerates, that kind of outer tough ring can start to thin, and then the softer center can actually herniate out. And that's what had happened in her case. So, she had mentioned that she had been having about a year of back pain prior to that. What had been happening was the disc was just degenerating to the point where that outer tough ring couldn't hold in the softer center part to where it herniated out and was now pushing considerably on her nerve going into her leg, which is what was causing all of this pain.
Wow, that sounds pretty serious. After you were able to really pinpoint what was going on with her, what were the treatment options for Misty at that particular point? Yeah,
so, of course, with Misty and like with all my patients, I always discuss any option we can to help treat this. And usually it starts with non-operative care. Things like physical therapy, we talked about some injections, and what that means is just steroid injections kind of around the area of the nerve just to help relieve inflammation and pain. And of course, pain medications is an option. And sometimes with time, these things will get better on their own, but they don't always need surgery.
Dr. Hennessy, what did you have to do for Misty?
So in Misty's case, what ultimately had to happen is we had to remove that pressure off her nerve, and in order to do that, we had to take out that bad disc. So in her case, I used a device very similar to this, through a very small incision from the front, where we actually removed the entire disc, taking pressure off of the nerve and also restoring the normal alignment in her spine, which treated not only the disc herniation, but also the other problem that she was having, which was resulting in the back pain.
Misty, you've gone through this. What was on your mind when Dr. Hennessy first said, okay, surgery?
I think it was almost a relief at first to know that we could see what the problem was. In the emergency room, they told me it was sciatic nerve problems, and I was like, how am I going to get over that? And so when we actually got to Dr. Hennessy and he could show me exactly what the problem was, then it just became asking lots of questions and figuring out the best course that would work best for me and for my family.
How are you feeling now?
I feel great.
Okay.
I feel absolutely great.
That's exactly what we like to hear, and I'm sure that's what you like to hear from patients as well. All right, thank you both so much.
Nothing makes me happier.
I hear you. I understand. Renova has locations in Dallas, Addison, and Fort Worth. Give them a call at 855-4FIX-PAIN or 855-434-9724, or go to renovasspinecare.com.